I have been diagnosed with breast cancer. 6 weeks ago, I was up on my mammograms, went in January. I have a history of breast cancer in my family. My grandmother died of breast cancer, my beautiful grandmother. My mother had a double mastectomy, healthy now. And so I was planning on getting the preventative surgery. That was my choice because I have a 60 to 90% chance of getting breast cancer. When I went in for my scans to get the preventative surgery, and this is all in the matter of 3 weeks, they found cancer. And so that test saved my life. Had I not gotten the test, I wouldn't have gotten the scans, and we would be telling a very different story. So I feel super grateful to be here, to be able to say, talk to your doctors and go get tested.
So earlier today, Jill Martin revealed that she was diagnosed with breast cancer only a few weeks after finding out that her and her father tested positive for carrying the BRCA2 mutation.
My name is Dr. Robin Roth, aka the Booby Docs. I'm a board-certified radiologist specializing in breast imaging, and here are 5 things that we can learn from Jill Martin's breast cancer diagnosis. So first, some background. BRCA1 and 2 genes are tumor-suppressing genes that help fight cancer. BRCA mutations are the most common cancer-causing genetic mutations out there. Carrying a BRCA mutation increases risk of developing cancer in both men and women. Increases your risk of developing breast, ovarian, pancreatic, prostate cancer, and melanoma. Number 2, BRCA mutations can be passed down by your mother or your father. If either one of your parents carry a BRCA mutation, they have a 50% chance of passing it down to their offspring. Jill Martin was probably falsely reassured by her mom's lack of carrying the BRCA mutation when she was diagnosed with premenopausal breast cancer back in her 40s, and again more recently.
It turns out she inherited the BRCA2 mutation from her father, who was recently diagnosed as well.
Men who carry a BRCA mutation are about 8 times more likely to get a breast cancer diagnosis than without the mutation. So the average risk of men developing breast cancer is about 1%. Men with BRCA mutations have a risk of about 8%.
And just in case you missed my earlier post, Beyonce's dad was diagnosed with breast cancer and was later found to have a BRCA2 mutation as well.
High-risk men would benefit from a monthly self-breast exam and also consider mammographic screening at age 50 or 10 years earlier than a first-degree relative to a diagnosis of breast cancer. Also, genetic testing has come so far over the last decade, and now tests for over 60 cancer-causing genes, including BRCA1 and 2, and also common genetic mutations with less good PR than the Angelina Jolie effect, including ATM, P53, CHEK2, just to name a few. So if your genetic testing is more than 8 to 10 years old, you're probably due for a repeat. Also, the cost of genetic testing has gone down significantly, and there are lots of programs that offer free or discounted genetic screening to those who want it. Even without genetic testing, Jill has other breast cancer risk factors that would place her at high risk for developing breast cancer. Premenopausal breast cancer in a first-degree relative, also a second-degree relative. She's Jewish, probably Ashkenazi Jewish, and Ashkenazi Jewish people are 10 times more likely to carry the BRCA mutation than the general public. The risk of carrying a BRCA mutation in the Ashkenazi Jewish population is 1 in 40 as opposed to 1 in 400 in the general population. Also, it's important to note that Black people are more likely to carry BRCA mutation but are less likely to be offered genetic screening. Hashtag breast cancer disparities. Many experts agree that all Ashkenazi Jewish and Black women should consider genetic screening. And she most likely has dense breast tissue because she mentioned that her breast cancer was not seen well on mammography even once they knew she had a breast cancer diagnosis. All those things add up to greater than 20% lifetime risk, which is at increased risk for breast cancer. Jill was diagnosed with BRCA mutation at age 47, and that really is too late. Ideally, we'd want to identify people that are high risk before age 30 so that we can identify women that would benefit from earlier and high risk screening. People that have an elevated lifetime risk of breast cancer are screened with mammography as early as age 30 and MRI as early as age 25, usually alternating every 6 months. I always encourage people to talk with their doctors about their breast cancer risk score, but you could always figure out your lifetime risk of developing breast cancer using the Tyrer-Cuzick calculator. Google it. Also, Jill's story highlights the point that mammography is not perfect, especially in women with dense breast tissue. Breast cancers are usually white and dense breast tissue is white, so having more dense tissue makes it harder to find small breast cancers using mammography alone. It's also an independent risk factor for developing breast cancer, so it's kind of like a double-edged sword.
Mammography alone has been shown to miss about 1 in 8 breast cancers, especially in women with dense breast tissue, but by adding supplemental ultrasound or MRI, depending on your risk factors, we're able to find smaller breast cancers at an earlier, more treatable developmental stage. Talk to your doctor if supplemental imaging is right for you.
So about 50% of women have dense breast tissue, and the only way to know your breast density is by reading your mammogram report. If you read heterogeneously or extremely dense breast tissue, then you have dense breast tissue, and you may benefit from supplemental screening such as ultrasound or MRI, depending on your risk factors.
I am talking about this not to scare you, but to raise awareness so that maybe you could be tested and identify a BRCA or other genetic mutation earlier. If I had known I was BRCA1 positive, I would have gotten screened more regularly with an MRI alternating with my mammograms. What I didn't know is that MRI could pick up cancers that mammograms can miss. An MRI might have helped me catch it earlier. Earlier testing may have allowed me the opportunity to have preventative surgery, which is something I planned on doing only days before I found out I actually had cancer.
Jill is undergoing double mastectomy and reconstruction in a few days, and in a few months will be undergoing preventative removal of her ovaries and fallopian tubes because her risk of developing ovarian cancer is now over 20%. I am wishing Jill Martin, her father, and the rest of her family the best of luck as they navigate this difficult time. Jill, this is your official welcome to the breast cancer community. Worst club, best members. I can't wait to see about the Jill Martin effect in a few years. As always, follow the Booby Docs for more of the breast information.
Can we just say we love you very much? We cannot wait to see you on the other side of this.
I feel devastated and sad and scared, but I feel empowered and strong. And my dad said, we got this. And so my husband's right there, and I have the best doctors in my family, and I got this. I got this. Just please see your doctors and see if genetic testing is appropriate.